Understanding caregiver stress. A 2003 study of caregivers by a research team at Ohio State University has proven the oft-repeated adage, "stress can kill you," is true. The focus of the investigation was the effect the stress of caregiving had on caregivers. The team, led by Dr. Janice Kiekult-Glaser, reports on a 6-year study of elderly people caring for spouses with Alzheimer's disease. The study not only found a significant deterioration in the health of caregivers when compared to a similar group of non-caregivers but also found the caregivers had a 63% higher death rate than the control group. The demands on a caregiver result in a great deal of stress. It is often observed in aging publications that stress can induce illness and depression. The resulting poor health can further decrease the effectiveness of the caregiver and in some cases, as proven by the study mentioned above, even cause premature death. Stress can be defined as a physiological reaction to a threat. The greater the threat, the greater the level of stress. A threat is a real or perceived action against our person. Threats may include the anticipated possibility of death or injury but may also include challenges to our self-esteem, social standing or relationships to others, or a threat may simply be a potential or real disruption of our established routines. What is stressful to one person may not be to another. For example, bumper-to-bumper traffic might be stressful to the woman executive who is late for an important meeting, but to the delivery man who has no deadline and is being paid by the hour, it may be a welcome respite to relax and listen to the radio. Stress produces real physical changes. In some unknown way, the fears in our mind, both conscious and unconscious, cause the hypothalamus and pituitary glands, deep in our brain, to initiate a cascade of hormones and immune system proteins that temporarily alter our physical body. This is a normal human physiological response inherent to the human body when a threat is perceived real or not. It is often called the fight or flight response, or the stress response. The purpose is to give us clearer thought and increased strength, as well as to activate the immune system to deal with potential injury and to repair potential wounds. When the perceived threat is removed, assuming no damage is done, the body returns to normal. Academy of Sciences on a 6-year study of elderly people caring for spouses with Alzheimer's disease. With the caregivers, the team found a 4-fold increase in an immune system protein interleukin-6, IL-6, as compared to an identically matched control group of non-caregivers. Only the stress of caregiving correlated to the marked increase of IL-6 in the caregiver group. All other factors, including age, were not significant to the outcome. Even the younger caregivers saw an increase in IL-6. The study also found that the caregivers had a 63% higher death rate than the control group. About 70% of the caregivers died before the end of the study and had to be replaced by new subjects. Another surprising result was that high levels of IL-6 continued even 3 years after the caregiving stopped. Dr. Glaser proposes the prolonged stress may have triggered a permanent abnormality of the immune system. IL-6 is only one cytokine, an immune system mediator protein in a cascade of endocrine hormones and cytokines that are released when the brain signals a person is threatened with harm, injury, undue mental or physical stress, or death. The hormones prepare the body to react quickly by increasing heart rate, making muscles more reactive, stimulating thought, altering sugar metabolism, and producing many more changes that result in the rush people experience when they think they may be harmed. The problem is if this response is initiated over and over again, frequently, and over a long period, it can have a dangerous effect on the body. This constant initiation of the stress response is common among caregivers, especially those caring for loved ones with dementia. Providing supervision or physical assistance many hours a week and over a period of years turns out to be extremely stressful. This type of stress is often unrelenting, occurring day after day and week after week. And the long-term effects of this stress are more pronounced in middle-aged and older people, who are precisely the group most likely offering long-term care to loved ones. In most younger people, when the threat lessens or disappears, the body reacts fairly quickly to shut down the stress response and return things to normal. But numerous studies have shown, as people age, the chemical cascade from stress lingers. Over a period of time, this constant chemical stimulus impairs the immune system and results in early aging, development of debilitating disease, and early death. In this altered state, the body maintains high, potentially harmful levels of IL-6. The body does not return to normal without intervention. This debilitating response to chronic stress is not unique to humans. Animals are affected as well. A 2004 PBS Scientific American Frontiers special entitled, Worried Sick, explored the effect of chronic stress on animals. Observations in the field and experiments on animals exposed to chronic stress uncovered the same phenomenon of debilitating disease and early death found in humans. Blood tests on the affected animals confirmed high levels of IL-6. The work of Dr. Janice Kiekult-Glazier's team was also followed in the special. The information above should provide a compelling reason to eliminate or reduce the stress of caregiving. Following are some strategies to deal with caregiver stress. Strategies to reduce caregiver stress. Ask for help. Most caregivers are reluctantly thrust into their role without preparation because the need for care usually comes with little warning. Caregivers end up operating in a crisis mode, arranging medical care and living arrangements, scheduling care time, providing meals and household chores and so forth. Because they are so stressed and burdened, they rarely take time to find out what resources are available to help them. Ironically, caregivers often sever ties with family, friends and support groups about this time, just when help from these people is most needed. As a caregiver, you must ask for help. The stress of going it alone is dangerous to your health. If it's difficult to ask for yourself, use an advocate, a sibling, friend or professional care manager to arrange a meeting and get formal, written commitments from those people who are willing to help you. The extra help will give you breathing room to find all those resources that are there to help you. Seek care management advice. A number of organizations and private companies will give you advice and guidance, many for free. If your care recipient has a very low income, you might get free help from your local area agency on aging. A lot depends on available funds. Go to http://www.longtermcarelink.net/eldercare/ref_state_aging_services.htm for statewide lists of agencies. A good source of free professional advice is the rapidly growing business of non-medical home care companies. Most will offer free consultations, and these companies will also provide paid aids to help you with your loved on such things as bathing, dressing, shopping, household chores, transportation, companionship and much more. These people may also help you coordinate adult daycare or other community services. Go to http://www.longtermcarelink.net/a7homecare.htm for a nationwide list. You may wish to pay for a formal assessment and care plan from a professional geriatric care manager. Go to http://www.longtermcarelink.net/a2bfinemanager.htm for a nationwide list of these valuable care specialists. Even though it may cost you a little money to hire a care manager, this could be the best money you will ever spend. Care managers are valuable in helping find supporting resources, providing respite, saving money from care providers, finding money to pay for care, making arrangements with family or government providers, and providing advice on issues that you may be struggling with. Take time off, find temporary substitutes. Taking a break from caregiving is just as important as taking a break at work or taking that long-awaited vacation. A care manager may be of help in selecting the best temporary help to give you a break. Or you may make arrangements with family or friends to give you a break from caregiving. Make plans for funding future care arrangements for you or for a healthy parent. The analysis of data from 3 national surveys, Mature Market Institute, National Alliance for Caregiving and Life Plans, Inc., points out that employees caring for disabled elders who have long-term care insurance, LTCI, are nearly 2 times more likely to be able to continue working than those caring for non-insured relatives. In addition, working caregivers of those with long-term care insurance said that they were less likely to experience some type of stress, such as having to give constant attention to the care recipient or having to provide care while not feeling well themselves. Also, the group with insurance devoted more quality time, more companionship and less hands-on assistance than the group without. See if your healthy parent can still buy insurance. If he or she can't afford it, See if other family members might contribute to premiums. There are also useful strategies using a reverse mortgage to buy long-term care insurance and life insurance for your loved ones. You should also consider insurance for yourself so when you need care someday, it won't be so stressful on your caregivers. Use assistive technology. There are a number of technologies to make sure your loved ones are safe while you're away. Such things as emergency alert bracelets and pendants, GPS tracking for wandering, remote video surveillance, telehome care, sensory augmentation and all sorts of assistive devices to help disabled people cope on their own. Go to http://www.longtermcarelink.net/ for more information. Remove non-caregiving stress from your job or at home. It's obvious if you can remove other stressors in your life, you can cope better with the stress of caregiving, which you may not want to or can't remove. The internet is your best resource here. Go to www.google.com, the most relevant non-commercial search engine on the net. Type in work stress, and you can browse 3 million plus URLs. For home stress, type in home stress, and browse 4 million plus URLs. Everything you ever wanted to know is buried somewhere in those millions of pages. This article is sponsored by Signal Health Group, Assisted Care at Home, and Signal Health Group franchise. If you're searching for personal care, home health, or hospice care, reach out to us to discuss the costs as well as the coverage you may receive from your current health insurance providers. We would be happy to help you stay safe, healthy, and comfortable in your home for as long as possible. For those who are interested in business opportunities, Signal Health Group is a franchise. With the number of older individuals growing every day, choosing to run a home care agency is a wise idea. Learn more about our services offered across the United States and business opportunities at signalhg.com.